Hey everyone, welcome to the Happy Flosser podcast. My name is Billy Lunt. I am your host, and I'm here to talk to you about all things dental hygiene to support you on your journey through the dental hygiene program. It is so great to be with you today. I hope that your semester is going really well, and this is the time in the semester where things start to get a little more challenging as far as keeping up with your energy, keeping your stress level down, staying organized, and really staying ambitious to see things through till the end. This is the challenging part of the semester where you just start to run out of energy. You might feel a little defeated. You might feel a little bit like you might not get everything done. But I assure you, these are all normal ways to feel. In today's episode, we're going to be talking about a real basic review from Anatomy and Physiology on the arterial vascular supply of the head and neck region. And it's really important that you understand the basics of how blood moves around the body so that you can understand the arteries, the veins, and actually the lymphatic system as well. So everything builds on itself. So it's really important that you have a good foundation and a good understanding before you start diving in. And you probably want to know a good review of osteology, right? The bones of the head, because the bones of the head kind of impact the names associated with the arterial vascular supply going on as well. So if you are having trouble learning just the basics first, things just get a little bit harder. So if you take a little bit of time to really review the basics and kind of review anatomy and physiology, which you've all taken anatomy and physiology at different points in your learning journey. Maybe you took it to get into the dental hygiene program. Maybe you're taking it, maybe you just took it, so this won't be so difficult, or maybe it's been a couple of years. So this is a really valuable episode to listen to. The vascular system of the head and neck is really made up of the blood supply, a capillary network, and venous drainage. And there's some basic terms that you want to look up and become familiar with. And these should all be in your textbook. Things like anastomoses. Anastomoses is how most of the transitions occur through the vascular system and actually the nerves as well. Arterial and artery, capillary, bacteremia, carotid pulse, embolus, thrombus, plexus, venous, sinus. These are all words associated with the system. And sometimes you can get lost in the learning if you don't have a good understanding of those key terms. So blood vessels communicate with each other within the system by anastomoses, which is a network of vessels, and they communicate together. Anastomoses is the term that we use to describe that. Having understanding of the vascular system is really important in dentistry because these vessels carry the blood to and from the head and neck region. And think about dental disease or infection. Your patients may fall victim to some of these complications, and these vessels spread infection to other areas of the body. Think about all of the connection of the clinical piece in dentistry. Why do our patients need to take a pre-medication, or why do we have to have a med consult before they come in? And a lot of that will connect the dots for you on how the vascular system plays a role in dentistry. You have to be able to locate some of those larger blood vessels of the head and neck because those vessels may become compromised during the process of a dental procedure or when you're administering local anesthesia. Some of our hygienists are out there administering Botox now. So think about reviewing the pathways of the arteries and veins as they exit and enter the heart. It's really important for you to understand the origins of the blood vessels of the head and neck because these origins supply the head and neck, and that means that those are pathways for not only the blood vessels, for the blood to travel, but also infection to travel. And think about when you are performing a prophylaxis on your patient, you're exposing that bloodstream to a really elevated dose of bacteria. So you want to have a good understanding of the travel pathways for not only the blood, but for the pathogens as well. As you can easily spread disease and infection, and it can spread because of the number of channel pathways that things can move. So this is really important. Blood vessels are less numerous than lymphatic vessels, and the venous portion runs parallel with the lymphatic vessels. So that's why it's important for you to learn the lymphatic system and the vascular system all together. So those connecting channels among the blood vessels cause that communication piece to happen. And the carotid vessels are the major pathways that go from the heart to the brain. So remember, in review, that arterial blood supply, you've got the heart, you've got the aorta, you've got the common carotids, the carotid sinus, and then you have that external and internal carotid artery. Now, the pathway from the aorta on the right side, you have the brachiocephalic artery, which divides into two branches, and then you have the subclavian arteries, and those flow to the arms. The common carotid artery is what flows to the head region. On the left side, you have the aorta and the left subclavian artery. The left common carotid artery and the two branches come directly from the aorta. The common carotid artery travels in the carotid sheath deep in that sternocleidomastoid muscle, and the carotid sheath also contains the internal jugular veins and the 10th cranial nerve. Right, the vagus nerve. The carotid sheath is part of the deep cervical fascia of the neck that is deep to the superficial cervical fascia. So think about all of the lymph nodes that are in that particular region, right next to the carotid artery. Now, the common carotid artery travels in the carotid sheath. It's anterior to the sternocleidomastoid muscle, and it's just slightly beneath the muscle. The carotid sinus is right before that common carotid artery divides. It's just a little small swelling, and it's located right at the level of the thyroid cartilage. The carotid pulse, right? We're all familiar with that when we take CPR. It's the most reliable pulse of the body. And this is why it's also very easy to feel. This is why we go for the common carotid artery pulse when we palpate against the larynx. You can use it to monitor a patient pretty easily because it's very accessible. It's easy to find. So you want the anterior border of that sternocleidomastoid muscle is rolled posteriorly at the level of that thyroid cartilage of the larynx or the Adam's apple, and that will make it easy for you to locate that carotid pulse, and that can be felt fairly easily. And I'm sure all of you did this yourself if you're doing maybe any kind of activity or you're monitoring your pulse when you're doing exercise activity or when you took your CPR. And now some of the different pulse points, you have your temporal artery, you can feel a pulse, your facial artery, you can feel a pulse, your brachial artery, you can feel a pulse, and the radial artery right down by your thumb. Those are all really common spots to feel. Those are called your pulse points. So the common carotid artery divides right below the mandible to the internal carotid and the external carotid. The internal carotid artery supplies the cranium to supply the brain, and the external carotid artery goes on the outside of the head and neck about the level of the larynx. The internal carotid artery is hidden by that sternocleidomastoid muscle, and there's no branches in the neck. It enters the skull to the cranium through the carotid canal. 11 branches supply the intracranial structure. Let's take a closer look at the external carotid artery. It supplies principal areas of the oral cavity and the face. And you have 4 sets of branches, and they're grouped by the location. Anterior, meaning the front area of the face. Medial, the middle portion of the face. Posterior, the back of the face. And terminal meaning the end branches of the carotid artery. It's a lot easier when you're learning the external carotid artery to study it in smaller sections. So starting with the anterior region. The anterior region includes the superior thyroid, the lingual and sublingual. So think about where we're located. The facial. You've got the ascending palatine, the submental, the inferior and superior labial, and then the angular. So when you're thinking about the superior thyroid artery and the branches that supply the following structures, think about it, inferior of the hyoid bone. You have the infrahyoid muscles, the sternocleidomastoid muscles, and the thyroid gland. When you look at the lingual artery, the lingual artery is an anterior branch from the external carotid artery, and that arises from the superior to the thyroid artery at the level of the hyoid bone. And there are several branches. Our focus is the lingual artery and the sublingual artery. The lingual artery supplies the floor of the mouth, the suprahyoid muscle, the muscles of the tongue posterior dorsal surface, the ventral surface to the apex, and the muscles of the soft palate. So think about how much is covered with that external carotid artery just in the anterior region. The lingual artery gives rise to the sublingual artery, which supplies the mylohyoid muscle, the sublingual salivary glands, the mucous membranes of the floor of the mouth, as well as the lingual gingiva. And the facial artery has a complicated path. That artery runs medial to the mandible, superior to the submandibular salivary gland, and then near the mandible's inferior border of the lateral side. And in this case, a visual image might be really helpful for you, but it kind of travels in this really interesting pathway. That facial artery runs deep to the submandibular gland. It crosses the lower border of the mandible toward the angle of the mouth and alongside of the nose. It supplies the muscles of facial expression in the nasal region. That facial artery and the branches are so important in dentistry. The ascending palatine, the submental, the inferior labial, the superior labial, and the angular. The ascending palatine artery is the first branch from the facial artery, and it's located near the neck region. And then the branch, the ascending palatine artery, supplies the soft palate, the muscles of the soft palate, and the palatine tonsils. The submental artery supplies the submandibular lymph nodes, the submandibular salivary gland, the mylohyoid muscle, along with the sublingual artery, and the digastric muscle. It's important to note that the suprahyoid muscles are also supplied by the sublingual artery. The vessels overlap in this particular region. That facial artery, you have the inferior labial artery and the superior labial artery. The inferior labial artery supplies the lower lip area, including the area's muscles of facial expression, such as the depressor anguli oris or the depressor labii inferioris and the mentalis muscles. Now, the superior labial artery supplies the upper lip area and similarly the area's muscles of facial expression, such as the levator labii oris, the levator labius superioris. So the region makes sense that the muscles close to that particular artery is supplied by that artery. Now, the medial branch has the ascending pharyngeal artery, and that supplies the pharyngeal walls, parts of the soft palate, the meninges, and it forms anastomosis with the ascending palatine artery. Let's take a look at the posterior branch. The posterior branch, so in the back, has the occipital artery and the posterior auricular artery. So think about the ear, that region. So that's the whole posterior branch area. The occipital artery travels to the posterior portion of the scalp, and it supplies the suprahyoid, the sternocleidomastoid muscle, the scalp, and the meningeal tissue. The suprahyoid muscles are also supplied by the sublingual and submental arteries. These vessels overlap in this area, so some areas are supplied by multiple branches. The occipital artery branches supply the occipital artery. It undergoes anastomosis between the external carotid and the subclavian artery to provide regional collateral circulation. And the branches of the occipital artery undergo anastomosis between the external carotid and the subclavian artery in order to provide regional collateral circulation in this particular region. So this is where the posterior branch supplies. The posterior auricular artery arises superior to the occipital artery and the stylohyoid muscle at the level of the styloid process. See why it's really important for you to understand the bones first? It supplies the inner ear. I'm hoping that this basic review of the traveling pathways of all of the arteries and vessels was helpful for you to build foundational knowledge so that as you take a look at the terminal branches and connect the dots between the bones, the muscles of facial expression, and the arteries and veins, it will help you as you move forward to learning and understanding the cranial nerves and how everything is connected and supplied. There are some confusing topics that some students struggle with, things such as when something is supplied by multiple branches. I want you to think of a forest and a connection network. On the outside, it just looks like a bunch of individual trees. But if you were to look underneath the dirt, a few layers deep, you would see that there is a network all tied together to supply all of the trees with everything that they need. That was helpful for me when I was learning the vessels and arteries. Hopefully that is helpful for you. I hope that you guys are having a great week. Please like and share my podcast. I really would appreciate it if you tell your friends about the podcast. And if it's helped you at all, I really appreciate that you do that as a service to your fellow student. I also have created a scorecard for you to see where you're at as your resilience as a student. You can click on the link right in the show notes, and it will help you with the different areas of being a student that is successful in dental hygiene school. And you can go through the scorecard, score yourself, and then see where the areas are that you need to improve on. Maybe you're in your first semester. Maybe you're in your last semester. It does not matter. The learning continues and evolves over time. So if the scorecard is something that interests you, you can go ahead and download that and give it a try. And if you do really well on the scorecard, you can always share that with me. I'd love to hear how you do on the scorecard. If you need support after you've done the scorecard and you're like, how do I improve in this area? I'd also be happy to help you with that too. So have a great week, everyone. We'll see you soon.